Good morning, everyone. Welcome to day 2 of the Young Invincibles 2022 Outreach and Enrollment Planning Summit. My name is Di Brown, and I am the Deputy Executive Director of Young Invincibles. I want to begin by sending our thoughts and prayers to our friends in Florida. They make up an important part of our outreach and enrollment community, and we wish them safety and hope as the storm passes and recovery begins. We hope you enjoyed day 1, and we're excited to have you back today for more. For those joining us for the first time today, welcome. We're happy you're here. The summit really embodies our values here at Young Invincibles. We believe in the power of community and collaboration, and that is what this summit is all about, building a national community of folks who share in the passion for getting people access to quality, affordable healthcare and coverage. We're providing a few opportunities for you to do just that this afternoon during our open forum session, as well as our end of the day happy hour. We hope you'll join us to connect and share ideas with your colleagues across the nation. To start us off today, I am honored to introduce someone who shares our passion for ensuring communities have access to health coverage and care. Secretary Javier Becerra. Javier Becerra is the 25th Secretary of the Department of Health and Human Services, and the first Latino to hold the office in the history of the United States. As Secretary, he carries out President Biden's vision to build a healthy America, and his work focuses on ensuring that all Americans have health security and health care access. Throughout his career, the Secretary has made it his priority to ensure that Americans have access to the affordable health care they need to survive and thrive. From his early days as a legal advocate representing individuals with mental illness to his role as the Attorney General of the state of California. Prior to his service at HHS, Secretary Becerra served 12 terms in Congress as a member of the U.S. House of Representatives, serving as chairman of his party's caucus and as the ranking member of the Ways and Means Subcommittee on Social Security and ranking member of the Subcommittee on Health. He is also proud to be one of the original composers of the Affordable Care Act. Following his tenure in Congress, Secretary Becerra served as Attorney General of the state of California, where he led the 3-year federal court fight to save the ACA, and with it, the protections of the 133 million Americans with pre-existing conditions. Additionally, as Attorney General, he took action early in the pandemic to keep Californians safe by using his authority to protect workers from exposure to COVID-19, secure key safeguards for frontline healthcare workers' rights, and take on fraudsters trying to take advantage of people during the pandemic. Born in Sacramento, Secretary Becerra is the son of working-class parents. He was the first in his family to receive a 4-year degree, earning his Bachelor of Arts in Economics from Stanford University. He earned his Juris Doctorate from Stanford Law School. Today, I am proud to introduce the 25th Secretary of the Department of Health and Human Services, Javier Becerra.
Di, thank you very much to you, to Kristen, and all the leadership of Young Invincibles, and certainly to every one of the Young Invincibles. Boy, don't we wish we can always hold on to that title, not just invincible, but young. Some of you aren't as young as you used to be. You're still invincible. That's what counts. So you'll get to keep the young part as well. All I know is that whatever you are, whatever you want to call yourself, you help us win. And we want to be with winners. And so we want to be with you, and we hope you'll want to be with us as we continue this march to give everyone in America access to quality health care at prices they can afford. And thank God you were all there when we had to fight on the Affordable Care Act. Thank God you were there when we tried to retain it against all the efforts to try to dismantle it and repeal it. Thank God you were there to help us to show that we could actually break records when it came to the Affordable Care Act. And today, I think we can say that thank God, because of you, we are talking about expanding on the 14.5 million people who today have access to quality care, who have insurance coverage because of the Affordable Care Act. Because of you, we can move forward. When someone says the Affordable Care Act passed and there were people who made it happen, that was you. When people say, we didn't think we could get so many millions of Americans to believe that they could actually afford their care, but we were able to reach them. And now they were convinced because they trusted those voices. Those voices, that was you. And now that the president is saying, you know what, 14.5 million record numbers. Today, there are fewer Americans without health insurance than ever before. 8% or so are now uninsured. We were up in the double digits, high double digits before that. That work, that was you. The fact that today there are more people of color who have access to quality care than before, that was you. And now that the president has said, we're going to blow this out of the water again, we're going to make sure that those navigators can go out there and reach people who aren't accustomed to having someone actually come to them to help. Usually they have to go find us, but we're going to get out there. Nearly $100 million this coming year to do the work of navigators. That work, when it gets done, that is you. And so how do we say thank you to those who've proven themselves invincible, who've proven that they really want to make this work? All I can do is tell you is thank you, and let's partner up because we have a long way to go. You know, it's interesting. I always tell folks, especially when I have a chance to speak to younger folks who are really looking for ways to take the mantle. I always tell them, you want to know where a leader will take you? Look at where that leader's come from. My suspicion is that when you take a look at the leadership of Young Invincibles, when you take a look at all the people that are part of Young Invincibles, what you'll see is where they came from is a place where they understand that they can make a difference, where they understand that making a difference will help people like their families. I know my parents are looking at what I'm able to do. My parents look at what my grandkids their grandkids will do. And I believe what they're seeing is that it is leadership because it was inspired by previous generations. So to you, each and every one of you, continue to be invincible, stay young, but most importantly, be ready to lead. And do me a favor, as I tell my team at HHS, when you have a chance to be in a position to make a big difference, never do mild. This is not a time to do mild. So Young Invincibles, that should be you. Let's get ready. Don't do mild. I look forward to working with you, and thank you for having me today as you get ready to launch another great effort to help us get all Americans with good health coverage. Di, back to you.
Wow, what an honor. Thank you so much for being here with us today, Secretary Becerra. I think it's safe to say your dedication to protecting the Affordable Care Act has allowed millions of Americans to continue to get the health care they need. We appreciate all you've done and all you continue to do to support the outreach and enrollment community. Next, I'm happy to hand it over to Mina Schultz, Young Invincibles Health, Policy, and Advocacy Manager, to introduce our next guest today. Thanks everyone for having me this morning, and enjoy the summit. Mina, I think you're on mute.
Y'all, we're 3 years into this Zoom and I'm still staying on mute. Thanks, Di. As I was saying, thank you so much for being here. Thank you to Secretary Becerra for joining us today. It's good to see you all here for day 2. Secretary Becerra has been such an amazing healthcare champion. We're so appreciative of the work he's done to protect and build on the Affordable Care Act. So you guys, we're going into 10 years of open enrollment. 10 years. I know many of you joining us today have been in this field for that whole decade. And why I thank you all for everything that you've done to get your communities covered. We're so excited to have some new faces with us joining the outreach and enrollment community for the first time. We're happy to have you here with us. And that said, we've been fighting for the ACA for a while. We've had a lot of challenges, but we wanted to take a moment to kind of remind everyone why this work is so important. So as an introduction, we have a quick message from some of your colleagues across the country, and then we'll jump into some stories.
We here at Change Happens are so excited that we are still allowed to do this work and be a part of assisting individuals and families with getting the health insurance coverage that they deserve. Happy 10th anniversary Marketplace open enrollment.
Hi, I'm Deepak Madala. I'm a health insurance navigator with the Virginia Poverty Law Center. I've been a navigator since 2013, and I've loved being in that role because it's given me the opportunity to help so many people here get access to affordable health coverage.
Hi everybody, it's Allison. I am the Director of Covering Wisconsin. We are Wisconsin's federally certified and state licensed health insurance navigator agency. We have been in this since almost the very beginning. We started in open enrollment too. And boy, I feel like it has flown by, but also I remember every single open enrollment, both just how it felt for us as navigators and also just the kinds of consumer questions and confusions we have experienced over the years. Every day there are new questions and things that we don't feel we understand, so we know it's got to be even tougher for the public that we serve. We're excited for the work to come and the growth that we've seen in our team, and we know that there's so much more that we can do to help our communities just stay well and be financially secure. So thanks everybody, and happy to be a part of this.
El cuidado de salud está a tu alcance.
The ACA is saving lives.
The Affordable Care Act ayuda a la gente a controlar su salud.
The ACA is saving lives.
El ACA para la comunidad.
The ACA is awesome.
The ACA is hope.
La Ley de Asistencia Asequible es un programa fenomenal para la comunidad.
We are not doctors or nurses, but what we do saves lives.
ACA, health is wealth.
ACA is all of us.
Awesome. We love hearing from our navigators, and I think if you were here yesterday, you probably remember Stacy's face, bringing that energy as always. So thank you to all those sisters who are wishing us luck for 10 years of open enrollment. Now we wanted to let you all hear directly from those who have been actually impacted by the Affordable Care Act. These folks have been kind enough to join us today to share their stories of what the ACA means to them, and why it's so important for people to have access to quality health coverage and care. So it's my pleasure to introduce two incredible advocates today, Amanda Crowell-Itliong and Dr. Meena Butra, to tell you the stories of how some of the provisions of the ACA have helped them access necessary and life-saving healthcare. First, I'm going to hand it over to Dr. Meena, and thanks for being here today, Doctor.
Thank you so much. And it is truly actually my honor to speak here. I'm going to tell you right off the bat before I say anything else, navigators and assisters help out my patients and just random people who reach out to me all of the time. So I really, really, truly thank you. So my name is Meena Butra. I'm a doctor. I'm on the National Board of Doctors for America. But many years ago, I actually watched a newly formed Doctors for America with awe and gratitude, because I was a medical student and I was also a patient with an incurable illness. And I had experienced firsthand what healthcare was before the Affordable Care Act. So I had been in college, I was perfectly healthy, I was absolutely fine. In fact, I was training for the New York City Marathon. And then in the weeks prior to medical school, I started to become progressively, quickly very sick to the point where when I would try to walk up a flight of stairs, I would almost pass out. I was diagnosed in my first semester of medical school with severe inflammatory bowel disease. It's either Crohn's disease or ulcerative colitis. You may have heard of that. And despite aggressive medical therapy, I became sicker and sicker until 6 months later, I was hospitalized. I was blind in one eye. I had severe ischemia of my gut. I was unable to walk, unable to eat. And it actually just wasn't clear that I was going to get out of the hospital alive. So during that time, my medical school gave me a leave of absence. Medical school isn't cheap, not even back then. So my family really appreciated this. What we didn't realize was that the insurance company would take advantage of that to declare I was not an active student and therefore no longer qualified to be covered under my parents' insurance. Back then, you could only stay on it if you were an active student. So my medical school swiftly reinstated my active student status, and the insurance company said, well, now she has a pre-existing condition. My coverage over tripled, and I had already exceeded my annual cap on care. I was still hospitalized. It wasn't even the end of January. I started getting countless letters, calls from debt collectors. The minute I got out of the hospital, even before I could walk, I got a job so that I could pay some of these bills. And as soon as I could, I immediately rejoined my medical school. I didn't take any time off, this time because I needed the student health insurance that they had. Unfortunately, the student health insurance had caps on care as well. I could only see a doctor 3 times total across all of my medical problems in the entire year. And there was a cap on my medications. One of my medications exceeded that cap in 2 months. I had to drop out of the PhD program. I had to take out loans just to pay my bills and complete my medical school so I could get a job as a resident and have real health insurance. I now get to take care of patients who have the same illness I do, and it is so much easier to provide care for them. That does not mean that the disease is easier or that the complications are easier, but at least there is coverage for them. And I am so grateful for that. So my under 26-year-olds can stay on their parents' insurance. All of my patients can change their jobs or start or stop school without worrying that they have a pre-existing condition that would disqualify them from healthcare. And my patients who are lower income can get covered by Medicaid through the Medicaid expansion in our state. But some of my older patients and me, we remember what it was like before the Affordable Care Act. It wasn't that long ago. I remember the wife of one of my patients crying in the clinic during one of the attempted repeals of the ACA because she was so scared that her family would go back into medical bankruptcy because of healthcare bills for her husband. And I remember this. I remember rationing my own care. How few pills can I take to make them last longer? What could I afford this month? My blood work or going to see a doctor? How many doctor's visits had I already had? This is why every year the job you do is so, so important. I do outreach, not just to my patients, but nationally, but I don't have the answers to everything. And more often than not, I am reaching out to navigators like yourself and saying, hey, someone reached out to me. Could you help them get enrolled? Because this is the difference between life and death. Honestly, there's no joke. That's not an exaggeration. We are a great enough country to provide healthcare to everyone. Thank you so much for everything you are doing to get the word out and to get folks enrolled. As a patient and as a healthcare provider, I cannot thank you enough.
Thank you so much for sharing, Dr. Mina. I think it's easy to forget after, how many are we, 12 years now, outside of passage of the ACA, that things were pretty different before then, in the worst way possible. So thank you so much for sharing your experience. I know it can be tough to be vulnerable sometimes, and we really appreciate you being here. So next, it is my honor to hand the mic over to another incredible advocate who's been impacted by the ACA, Amanda Crowell-Itliong. Take it away.
Hi, good morning, everybody. Good afternoon to some of you. And I'm so honored to be here with you. I just really am appreciative of all the work everybody's been doing for so long and continues to do to make healthcare affordable and accessible to everybody who needs it in the United States. And that definitely has been me. I was one day about to go give an important speech in my field. I was 29. I felt really excited to go be at this conference and speaking at the breakfast plenary, which, if you know, that's not the fancy part. That's when everybody's hungover and like fighting over bagel, cream cheese flavors and stuff. But still, right? I was young, so I was honored. And it was a leadership conference. And I reached from my bag and I felt the worst pain I had ever felt. Like I knew it had to stop, or I knew I was going to pass out. Next thing I know, I'm on the floor in this fancy hotel in Denver, and I'm getting stuffed into an ambulance and headed to the ER. And I woke up hours and hours later, and somebody told me, the nurse who was checking my vitals, she said, "Oh, I'm so sorry to hear you have cancer." And nobody had even told me it was a possibility when I went under to have the surgery. And so I was really shocked. And it was a time before the ACA, and I didn't really, I was really lucky to have a great job at the time, and I had great health insurance, but now I had a pre-existing condition. I knew what that meant. I knew that was something that was going to always be something that I carried around with me, because we didn't have the ACA yet. And so it took until the fourth time that I got cancer, which was in 2014. And that was also what it took for me to really become an activist and an advocate for this stuff and change my career into working within healthcare. I was left for dead at that point. I had doctors who were amazing, some of the best in the country, but they told me, "We're so sorry, your rare cancer doesn't have any treatment options left." So I was also getting divorced because I had this husband who wasn't actually a caregiver. He was just kind of, the person that came along to appointments with me. And that put me at risk on a whole nother level too. Now I can't work, I'm getting divorced, and I'm getting left for dead by the medical community, and I'm terrified, right? And my family is too, because of course what we had before the ACA meant that not only individuals went bankrupt, but their whole families trying to care for them, right? And so I moved to Michigan because they actually expanded Medicaid. In North Carolina, if I'd stayed there, I wasn't going to be able to take advantage of Medicaid. It was great access to care for me. And when the ACA was at such high risk with the new administration and the election in 2016, I was hysterical on election night, literally so scared about my future because the ACA was at risk. And I thought, this is it. This is all of it. That night, as I'm crying to him on the phone, my best friend Patrick told me, "Doll, I'd marry you in a minute if you needed healthcare." And we've been in love ever since. It's 6 years later. So I almost had to depend on getting married, but instead it turned me into an activist, because it isn't just about that. It's like we need, it was more important than ever for all of us to fight for healthcare for everyone because of this new administration putting us all at risk in a different way. And I didn't want or need to get married, but of course I love him. And let me tell you about my friend Alex. He was an amazing, brilliant person who was about to graduate from Stanford with his PhD in electrical engineering, but this was before the ACA, and he had to pretend like he didn't finish his dissertation for 2 years while he was dying of cancer, because there was no way he could have access to healthcare if he graduated. He was a student, and that's what was keeping him. His student health plan was keeping him alive at that point. And so his degree was awarded posthumously after he passed. And that was one of the tragic stories for me, to know that was such a hard thing, that he didn't get to complete the thing he worked so hard on for so many years while he was alive, because he wouldn't have access to cancer care that he needed. And so it's important for all of us to keep fighting. And I run a cancer health disparities research program now, and we see how important the safety net is. Thank you for being a part of it. Thank you for helping to keep it for all of us. The safety net is something to me that is essentially American. And I'm so appreciative of all the work all of you do. Have a great day.
Thank you so much, Amanda, for sharing such a touching story. We're so glad to hear that you're still, doing all your activism and you're still kicking. I think your catchphrase is "not dead yet." if I remember correctly. And you're really doing so much for patients. We really appreciate that. And it really demonstrates the need to expand Medicaid in those remaining states. We need to get that done. And I know all kinds of advocates and activists are working on the ground to get that done. So thank you so much, Amanda and Dr. Mina. We appreciate, like I said, your hard work, and we look forward to following your continued fight for healthcare for all. On behalf of Young Invincibles, I want to give a huge thank you to you both for your dedication and your vulnerability today. It takes a lot to share your own story, but it does make a difference, and we appreciate you. So with that, we're going to wrap up this session with one last message from our wonderful assister community. So they can all say hi and thank you to you.
Hello, Assisters. My name is Mark Van Arnhem, and I'm the director of the North Carolina Navigator Consortium. I'd like to wish you all a happy OE10. Yes, 10 years of open enrollment. That's crazy. I don't know how it's possible. I'm only 25 and I've been here since the beginning. Have a great time and enjoy the conference.
Congratulations on the success and 10th anniversary of the ACA outreach and enrollment. Advancing the outreach and enrollment effort did take the healthcare.gov into higher level. It did help and support the increase of health coverage for the uninsured population in history. I'm glad and honored to witness this success.
Hey everybody, this is Jeremy Smith out of West Virginia, and I'm the program director for the Navigator program operated by First Choice Services. I myself have been a Navigator since the very first open enrollment period clear back in 2013. And as I look back, this has just been the most rewarding job that I've ever done. And I know me and my staff continue to be passionate about the work being done. We've seen tens of thousands of people here in West Virginia be able to get coverage because of the ACA. Some people for the first time ever. They'd never had insurance before. So this is just one of those special programs that I know I'm going to look back my whole life and be so happy that I was part of. And I just want to wish a very special 10th anniversary to the ACA from me and my staff in West Virginia. Congratulations, and let's keep it going.
We're the high-flying and hard-charging assisters at Legal Aid Services of Oklahoma. I'm Steve Goldman, the Ancient Mariner Navigator. After the wonderful surprise of Medicaid expansion last year, still our state's marketplace enrollment grew. But whether you've been a NAV or CAC for 10 years, 10 gray hair creating years, or if this is your very first year, you know, it's not the numbers. It's all about the people we help. Thanks to everyone.
And thank you guys. We really appreciate, again, all the work that our outreach and enrollment community does. And we hope that you're enjoying the summit so far. You know, now I hope you will all join us for the next session starting here in just a minute for a deep dive into the end of the COVID public health emergency and the impact it will have on Medicaid enrollees. So don't miss it, and we'll see you soon.